Uganda has the 10th highest prevalence of HIV in the world, with 151 new infections each day. Even so, the country has made significant progress fighting the disease. The annual number of AIDS-related deaths have dropped from about 92,000 in 2004 to 28,000 in 2016. And last year, Uganda made a bold commitment to end AIDS by 2030, the first pledge of its kind for any country in Africa or the world. But now that goal may be out of reach because of cuts in funding from its biggest donor of health aid, the United States.
Next is the policy in regard to Mexico City.
Like the 3 Republican presidents before him, President Trump reinstated the global gag rule. It requires foreign NGOs to agree not to, quote, perform or actively promote abortion in order to get U.S. support for family planning services. But Trump's version goes a step further to say that groups who don't comply will also lose support for nearly all global health programs, including those for HIV and AIDS.
Why do you do this kind of work?
I have a family to take care of, and I have no any other job that I can get.
How much money can you make in a night?
It's not constant. You can make 20, 30. During weekends, you can even make 40 or 50.
So anywhere from like $6 to $12 US.
Yeah.
Sex work in Uganda is illegal, but single mother Monica Nibira feels this is the only way she can support her 2 kids.
What's this?
This is the room. When I come direct from home, I come like this because I don't want to show my neighbors the kind of work I do. So I come with my changing clothes in the bag. After changing, I go to the hotspot. Start looking for clients.
How many nights a week are you working?
I work every day.
Are you able to get access to condoms now?
Sometime back, I've been able to. But these days, it's a big problem we're having.
And so are you having unprotected sex?
Well, we try our level best so that we can get, because unprotected sex is not safe. About HIV, I'm negative, but I do have STIs, and getting the medicine is not very easy.
Are you concerned that you're spreading your STIs to your clients?
Without condoms, they can get it. So that's why I try my level best to see that I get condoms.
When did you notice that you couldn't get access to condoms anymore?
Something like 5 months back.
To get condoms, Monica relies on an organization called Reproductive Health Uganda. They're part of the International Planned Parenthood Federation, who refused to sign the global gag rule. As a result, over the next 4 years, they estimate they'll lose $100 million in global funding and distribute 70 million fewer condoms. Dr. Peter Abembe is the director of programs for RHU.
What are the effects of this policy being put into place?
It's affecting the work we do. We work with vulnerable communities, poor women, people who don't have access to sexual and reproductive health and rights services. Cutting the funding, of course, immediately has a dramatic effect in that very many of the people who would otherwise be served with like family planning services, other services to the young people, or even HIV AIDS-related services are suffering. It's not easy to quantify the extent of the damage.
These cutbacks are already having serious consequences, especially for sex workers who face a high risk of contracting the virus. In fact, it's estimated that 1 in 3 female sex workers in Kampala is HIV positive.
How did you contract HIV? Are you concerned that you're spreading your HIV to your clients?
yova kana live tomanya ati naye mulwadde oba mulamu oba agenda kwongera oba ogenda kumusinga so singa tuba tufuna eddagala liri mu bungi netufuna condoms mu bungi nga zimala kiba kituyamba kutuba ku safe side.
Are there many other women who are going through the same thing you guys are?
All the sex workers balinganze.
Getting HIV services to these women, including counseling, prevention, and treatment, is key to halting the spread of the disease and eventually ending the epidemic.
How have you noticed this U.S. policy and the loss of funding affect this community?
Manya wenagenda mu ddwaliro wenagenda ku ddwaliro okufuna eddagala mbangamba eddagala balina ttono kati ne mbanyonyola ne bamubuuza wajova ne mbagamba ndi sex worker ne bangamba ate mwe ba sex workers abakola kuba mwe muzunzo obulwadde.
It's difficult to pinpoint exactly why sex workers have trouble accessing HIV treatment. They face discrimination from health providers, and drug supply chains are chronically inconsistent. Now these new cuts in aid are adding extra confusion to an already stressed system.
Bazirina ezituyamba kuba abantu tuli bangi n'abalwadde bangi ne ba sex workers bangi kati abantu tebakyalina mirimu ateberezaamu okutuula agenda ku kkubo n'agira n'akola emirimu n'agenda ne yeetunda bwe kiri.